telenursing and remote access telehealth. This is group number four's topic, and this is their introduction. Um, Telehealth um, is providing health care via telecommunications. Um, this telecommunications could either be by computer, could be by the phone, or some other remote telecommunication provider. Um, this goes back as far as history as concerned. Um, Really, it started. Telehealth has existed for decades. We think about in the late 1800s when the invention of the telephone. There, the doctors would use the telephone to provide health care to the ones that could not reach the doctor or was in a um, uh, something that was not developed, undeveloped territory. So the doctors would use the telephone there. So telehealth been been here for a while. It really hadn't come into play until right about 1999, when a lot of the doctors started to use this as clinics. They're using telehealth as clinics, uh, and especially a lot of nurse practitioners start to use to see patients via the computer. That saves the doctors a lot of time. Um, so with this of telecommunication, there was aspects for the nurse, and still the nurse they would deliver the nursing care. They would plan, they would evaluate. However, they would just do it by remote control or telemedicine. Um, there's a driving force for telehealth. Um, the biggest reason is they want to make it accessible to people who will not who or cannot go to a physician or a doctor, or because of where they live, or because if their state or if the country is not being developed or has been developed. Uh, so there's benefits for all this, and the benefits really uh, for uh, for the healthcare provider, they can do more with the limited resources. They can provide consistent diagnostic experiences, and they can improve the quality of care while reducing the cost. And it's just better for the patient if it's handled properly. Um, uh, or if it's handled poorly, telehealth can make the patient feel like they're not motivated. They'll be disengaged with both the provider and their care. But if it's done correctly, it can strengthen the patient provider's relationship, and it can have better. Um, it can provide better care for the patient. Um, um, the However, there has to be a patient involvement. There are a lot of uh, regulations that go with this, or illegalities that will be explained throughout this presentation. Like I said, the patient has a major role in providing, in being a provider or being a participant of telehealth or telemedicine. Um, there's a lot of research going on because telehealth, telemedicine is pretty new as far as being in an operative stage. Um, there's a lot of, um, like I say, research and different models of telehealth, telemedicine. People who are in, like in mental health, um, in the mental health community, they really see the benefit with this telecommunication, telehealth. However, they have to be a willing participant. Um, Sometimes the doctors or physicians cannot go to these correctional institutions, which provides good telehealth, telemedicine from them. Um, One big factor is the the nurse plays a very important role in this telemedicine. or because uh, they, like, like I mentioned before, their job still will have to remain as far as all the functions that a nurse have to do. A nurse, but the nurse has to have the education. It's a learning curve that they must attain to be proficient in telehealth, in telemedicine. So the care will stay the same. It's just that the educational will be strengthened, and this can provide both patient better patient care and patient safety.